start with Dr. Prem Nandhini from LV Prasad Eye Institute on a very important thing. We want to connect the real world with the virtual world, how we can do a virtual visual acuity testing in teleophthalmology. Prem Nandhini, please.
Thank you, Dr. Rajiv. I hope my slides are visible
Yeah,
and
they are
audible.
Yes.
Okay, so this is the data that I'll be presenting for today's talk essentially comes from a collaborative team effort of optometrists and ophthalmologists who are displayed here. I'm going to try and whip through so that I can stick to the time. As always, any pandemic brings all these stages of grief, and it's no different for COVID-19 also. But as healthcare professionals, we are in the acceptance stage and we are moving forward to adapt to the changing times. And one of the things is actually to move on to teleconsultation, teleophthalmology. So this is a survey that AIOS did exactly 1 year back. And we can see that 99% of ophthalmologists are interested in trying out mobile app-based teleophthalmology. Now, while there are different types of visual functions out there, the number one that we always focus on is visual acuity. So you may have color vision, contrast, etc., but we generally tend to give a primary focus for visual acuity, be it for the surgical success or for prescribing your spectacles. So if I type in visual acuity and teleophthalmology as the keywords, and this is some search that I did like a couple of days back. And if I simply say since 2020, how many articles are out there, you'll be surprised that literally about 20 papers per month comes out. And I suppose Google also boosts your ego by putting out your own paper on the top. So while before I actually talk about this study, which is primary focus of my talk today, I would actually like to take your attention that in terms of visual acuity testing, there are sort of two modes of doing it. One is self-administered and the other one requires another person to administer it. So this is a study that came out in Nature in Digital Medicine. And this was, of course, done before the pandemic era. And what they saw was while there are almost like more than 2,000 tools out there for self-administration of visual acuity tests, only 42 sort of fit that criteria. And the criteria is it has to be free or less than 5 pounds, and is there support and all of that. And even within that 42, there was only one that was validated against a gold standard. So clearly the tools that are just randomly out there are all not suitable for testing visual acuity. But then there are other tools that were specifically designed to be used by eye care professionals to test visual acuity. And a couple of that is the peak acuity and the smart optometry. So the study that that came out recently is something where we actually validated these two apps in order to find out whether they are reliable for measuring visual acuity as a part of teleconsultation. So this is the outline of the study. And primarily, I'll just, as I said, whip through these things and then maybe emphasize on what we learned through this process. So the study actually was conducted in 3 phases. In the first phase, what we did was we did a survey real quickly last year around April or so, soon after the lockdown started. And we actually targeted at our own employees. So we had about 43 people who participated. Of course, this was all online. So we had almost about equal gender distribution. And we also had close to equal distribution for clinical people who are already in eye care. They know what an acuity is, and also the non-clinical people. And the majority of these people were using the Android telephone. So we had asked them to install the smart optometry app and see if they can actually run the test by themselves as a self-administered test, and then rate and tell us how they felt about it. So majority of them said that it was definitely easy to install, and the instructions that came with the app was fairly clear to them. So this was encouraging that we could actually probably administer this test, as a part of the teleconsultation. So the next phase of the study was to now validate the tools. So for this, we actually validated the smart optometry, which primarily gives you the near visual acuity, and also the peak acuity, which can give you the distance visual acuity against our clinical standards. And our clinical testing is the computerized visual acuity chart that we use in the clinic. And because peak acuity comes with the tumbling E optotype, we decided that we will choose the tumbling E as the optotype for all the tests. So that way it becomes easier for us to compare each of these tests. And not only that, tumbling E can cut down your educational barrier. It can be used in children, and it can also be used across different people who speak different languages. So that was the good advantage over there. And this flow chart out here is actually showing you the protocol that we used. We followed all the COVID protocols. We first tested non-clinicians and then went to clinicians. And here are a couple of pictures. This is the examiner showing the peak acuity, and this is the smart optometry. And both these were installed on a tab. And as you can see, the tumbling optotype is presented there at 40 centimeters. So coming to the results, what we find is peak acuity definitely correlates very well with CompLog. The smart optometry, on the other hand, when we are comparing it to the reduced Snellen near vision chart, seem to show significant difference. And when we compare based on the age, young and old, we find that younger participants seem to have a difference. And also in terms of refractive error, the emmetropic people seem to have a difference. And these are the lines of limits of agreement, the Bland-Altman plot. And we also did repeatability, and peak acuity was more repeatable when compared to smart optometry. So the recommendation is peak acuity correlates very well with the clinical measurements. Smart optometry does correlate too, but we'll have to know what the limits of it are. The disadvantage with peak acuity is it would require another person to test it at 2 meters, but nevertheless, it can be taught. And this is an unpublished data. We are working on the manuscript now. And what this tells us, these are real patients who were shown an educational video of how to use peak acuity. And they measured it by themselves. And then we compared that to the clinical measure done in the clinic. And it seems to correlate pretty well. So this is encouraging. And this is the rating for the app given by the participants, the patients, and the majority of them were finding it easy to use this after we showed them the instructional video. So that is all I have. I hope I stayed within time. And thank you for your attention.
Thanks. Beautiful talk. And I think the take-home message is very clear. Just one question before I go to the next topic. Do you feel the ambient illumination and the illumination at chart, and many of these depends, like many things also depends on the tab or the phone you are using. So what would be, because people have now so many apps and they tend to use it on any of the digital device. What do you feel about it?
So because these are all self-illuminated devices, so in terms of the ambient light, it should not have much effect. And the other thing is peak acuity and smart optometry comes with its own calibration, and they automatically set the brightness to 100%. So most of that is taken care of. And peak has actually been employed out in the fields also in Africa.
Correct.
And so
no, even in India, in our Smart India study, we have used only the peak acuity. I think it works pretty